Hi, Mark and
Brian here.
back again. Now we're going to show you a few exercises that you can start typically immediately after surgery. But again, surgeon precautions first. So if they're okay with you starting this, here's some safe exercises you can start with typically either approach. Now with the anterior approach, since that's becoming so popular, the first thing that you want to get is hip extension, meaning this direction. So, because typically your hip flexors, so the muscles that flex your hip, typically get tight, so they will limit that. So that's a range of motion that you want to get. You want to loosen up that hip flexor on the surgical side. And as a result of that, because that becomes tight, your other hand, the opposite hamstring, so the hamstring on the good leg becomes tight. So those are two muscles you want to stretch out. So here is a very safe way to do that, because remember, if the surgeon does not want you hyperextending, so pulling your leg back too far, here's a safe way you can start working on stretching that. So you're going to lay on your back. So we're going to say it's Brian's left leg that he had surgery on. You're going to bend your right leg, just put it in a nice 90-90 position here. Now, you're going to tighten your abdominals and try to flatten your back into the mat, or what you're laying on. And from there then, you maintain that tension, and then you tighten your left leg and push it down. So that's going to work on shifting your pelvis and stretching these hip flexors here without overextending it. So you're in a safe position there, so you're following the precautions, but that will allow you to start working on stretching that hip flexor. So 5 to 10 second holds, relax, but the main thing is keep that back flattened, because that will help put a little bit of a stretch on your hip flexor from above, driving this leg into the mat from below. And it's a good safe way to start elongating. Breathe into it, stay relaxed, okay? Then a little bit of a progression from that, you can grab this leg, pull it up, hold it close to your chest, because that will help you tip your pelvis where you want it to be. And then the same thing. So you can see as he pulls this back, I pulled his leg up. So now he's going to tighten that, and that gives you a little bit more stretch there. But again, you are not hyperextending your hip, so you are in a safe position. So breathing into it, 5 to 10 second holds, 5 to 10 reps throughout the day. Very safe. Now part 2, we said the opposite hamstring is going to be tight. So while you're holding it there, you can work on gently stretching that, coming up and down. So this one you want to stretch the hamstring, and that will go hand in hand with stretching your hip flexor. Very easy. Again, 5 to 10 second holds, 5 to 10 reps, periodically throughout the day. Both of these you don't have to worry about your precautions, because you're not putting excessive stress on that repair. If you have further questions, contact us at fitness4lifept.com.